Learning Hub when it was still the CLTS Knowledge Hub, and I'm now working with them as an independent consultant, and I've been involved in this work on climate change and rural sanitation over the last, I think it's been a year and a half now, where we produced the Frontiers that some of you may have seen. I'm going to be your host for today. So I'm looking forward to the presentations that we have from our different presenters. So let me just introduce them to you. We have Dr. Devanmini Halwathura, who's a hydrometeorologist with experience in drought-related studies. She works as a senior lecturer in the Department of Zoology and Environment Science at the University of Colombo in Sri Lanka. And her research focuses on drought frequency analysis, soil and water surface water modeling, post-mining land reclamation, environmental flow analysis, and sustainable designs. We also have Professor Deepthi Wickramsinghe, who is a professor in the Department of Zoology and Environment Science in the University of Colombo as well. And she serves as a steering committee member of South Asia Global Water Partnership. Her interests include research, networking, and public outreach in the areas of water and gender, climate change, and disaster risk reduction. Then we have Dr. Indrajit Pal, who is an assistant professor and chair in disaster preparedness, mitigation and management in the Asian Institute of Technology in Thailand. And he has more than 18 years of experience in research, teaching, training, advocacy, consultancy, primarily focused on disaster risk governance, risk perceptions, public health risk, hazard risk, and resilience assessment. From the Sanitation Learning Hub at the Institute of Development Studies, we have Ruhil Iyer, and she's particularly interested in participatory research and actionable learning around themes such as climate change in the WASH sector. And finally, we have Dr. Jeremy Kohlitz from the Institute of Sustainable Futures. He's a WASH researcher there, and his research focuses on climate change, impacts on WASH, and equitable WASH service delivery. So welcome to our presenters. Very happy that we have this expertise here today. And yeah, we will be having presentations from all of them, and later on we'll have some time to go into breakout groups to have some discussion that's more interactive as well. In the course of the presentations, if you've got any questions, please put them in the chat, and we will aim to answer them there so that everyone can see them. And at the end of the session, after the breakout rooms, we'll have some time to feedback from the discussions in those breakout groups, and hopefully that will address some of the questions as well. So we're very happy that you're with us today, and without further ado, I'm going to hand over to Ruhil, who's going to kick us off.
Thank you for that introduction, Petra. I'm just going to check if everybody can see my screen.
Yes, we can.
Great. So just thank you for the introduction, and let's jump right in. So starting with some facts we already know. Over 2 billion people still lack access to basic sanitation, and the SDGs advocate for everyone to be using safely managed facilities by 2030. However, climate hazards and disasters can potentially worsen existing sanitation issues, can either stop or reverse all of the progress that we've made so far, and also it can increase public health risks, create barriers towards accessing safe sanitation, and then also increase the risk of slippage back to open defecation. Within all of this, marginalized groups that already struggle with safe sanitation are the most vulnerable, and they face the greatest climate risks. Many recent climate developments, like Finn was saying earlier, that have grown over the last few months and even over the last few years, show that these events and disasters and hazards are only becoming more common and more real for many people all around the world. But one thing which I think is a key thing to note is that climate change doesn't have to be a burdensome add-on to existing programming and existing approaches within the rural sanitation sector. So we're going to break all of this down today and unpack it during our session. We're going to start by presenting a framework on how climate hazards impact sanitation and hygiene practices at the local and community level, and how these experiences vary across gender, age, location, and more. This framework was put together by the Institute for Sustainable Futures and us at the Sanitation Learning Hub. Thereafter, we're going to present case studies from Asia. There we go. We're going to present case studies from Asia, so Colombo, or Sri Lanka, India, and Myanmar in particular, and unpack rural sanitation and hygiene programming during and after disasters. So Professor Wickramsinghe will present on whether climate emergency sanitation management is gender sensitive. Dr. Halwathura will present on whether sanitation has gained enough attention within drought conditions, and Dr. Paul will present on managing disasters. The various points that they intersect with water, sanitation, and larger livelihoods around people. We will then break into breakout group discussions to discuss ways we can start thinking and integrating climate concerns in rural sanitation and hygiene programming. So over to you, Jeremy.
Thanks very much, Ruhil. So shortly, our speakers are going to be sharing some real-world examples of how climate affects rural sanitation and hygiene, and actions that we can take in the sector to respond to that. But before that, we're just going to provide some orientation about some generic ways that climate affects rural sanitation and hygiene. So in the Frontiers piece that Ruhil just mentioned, that was produced by the Sanitation Learning Hub and Institute for Sustainable Futures, we categorize climate hazards in 4 different ways. And climate change is going to make each one of these hazards more impactful for sanitation and hygiene. So the first type of hazard are slow onset events. These are events that unfold slowly and gradually over time. At first, people might not really notice them until it's too late, and then people feel them quite severely, and their effects can be substantial. So for example, a drought, which people might not realize up front, but then affects people significantly later on. And one of our speakers is going to go into more detail on how droughts affect hygiene behaviors. A second type of hazard is shocks. And this might be what people most commonly think of when they think of climate change hazards. These are events that happen acutely and cause a lot of damage in a short period of time. For example, cyclones. A third type of hazard are trends. And trends are changes in long-term climate variables, such as average annual rainfall or average annual temperature. And of course, climate change is driving these to become higher and higher. And they're different from slow onset events in that they're also slow changing, but they're always kind of going on in the background. People might not know they're going on unless they're measured quantitatively. And then finally, climate change is causing more variability in climate systems. It's causing seasonality to become greater, with the wet season becoming wetter and the dry season becoming drier. And the climate change is also driving unpredictability in the climate system, so making it more difficult to predict when the rains are going to come or when certain climate events will occur. So these hazards affect rural sanitation and hygiene in 4 different ways. One way is that it impacts on people's behaviors. So a common component of rural sanitation interventions are behavior change communication, which may be successful under normal conditions, but under extreme weather, people may revert back to poor sanitation practices. And our speakers are going to give more details in some of their presentations about how extreme conditions impact, for example, menstrual hygiene management behaviors. Another way it affects sanitation and hygiene is via impacts on physical access. So for example, extreme events like floods or cyclones destroying latrine facilities, or this example from South Asia of a landslide blocking the pathway to a toilet facility, which made it difficult for people to access the toilets, especially people with disabilities. A third way that climate affects sanitation is indirectly via livelihoods. So obviously climate change affects all aspects of life, and a significant way is if it affects how people earn income. So if people are unable to earn income because, say, for example, a drought has affected their crops, it makes it more difficult for them to purchase latrines, and they may have competing priorities, for example, addressing food security that might take precedence over sanitation needs. And finally, impacts on resources and markets that are needed to construct and operate and maintain latrine facilities. For example, where water-based toilets are used, water for flushing may become unavailable. Or in this example, after a CLTS intervention, emptying services were not able to be carried out because of flooding conditions. So we've set up this framework to describe the impact pathways, which you see on the right here. In the outermost circle, I've already kind of introduced different types of climate hazards, and in the innermost circle are the impacts that I just described. It's important to note that impacts are differentiated across different social groups. Some people are affected more than others, and not everyone experiences impacts on sanitation and hygiene in the same ways. For example, gender makes a significant difference in how people experience impact, because as we know, women and men have different sanitation needs. And some of our speakers are going to talk a bit more about gender equality and the effects of extreme weather on sanitation and hygiene and how it affects women and menstrual hygiene management. The reason why some people are affected more than others is due to the social context, which you see higher up in the diagram. Social norms, structures, and socioeconomic context affect how people are exposed to disasters. For example, they may marginalized people may live in flood-prone areas or on hillsides where landslides are more likely to occur. It may make some people more sensitive to extreme weather than others. For example, if they have a latrine built from poor quality materials, it's more likely to be blown over by a storm than a more robustly constructed latrine from like a rich household. And it also influences people's capacity to respond. So for example, people who have political connections may be able to leverage local government to allocate resources for recovery in their area more than other groups who don't have those political connections. And finally, local activities also affect how impacts from climate hazards are felt. People can make the impacts worse, for example, by deforestation, which increases flooding that might be driven by climate change. But it can also offset those impacts. For example, climate change adaptation activities that are aimed to mitigate impacts. And one of our speakers will talk about emergency responses in water-related disasters and actions that can be taken to sort of offset these impacts. So this diagram sort of lays out everything in kind of neat packages, but in reality, this is a very complex space. The impacts are dynamic, they change over time. All of these factors don't interact with each other in predictable cause and effect kind of ways. And the impacts can be interpreted subjectively. So this is just sort of a framework for easier understanding, but in reality, this space is quite complex. So with that sort of orientation, I think we're now going to introduce the presentations from our speakers who are going to cover some kind of real world interesting examples of the ways that they've seen climate to affect sanitation and hygiene. So thanks very much.
Thanks, Jeremy. Indrajit, over to you.
Okay, thanks. Thanks, Jeremy. Can you hear me? Okay. So I'd like to cover like what Jeremy ended with the slow onset and sudden shock, and we also got few questions. So I'll be trying to cover a few aspects on the water related disasters and how it's actually impacting the sanitation segment or the sector, and few examples, case studies from 2 countries. Can you next please? From the data, we can see like the Asian context, about 90% of the natural hazards are water related. So it's a huge area we need to cover, and the impact also is significant due to the water related hazards. So Asia is also one of the most vulnerable in terms of the water related disasters, which is accounting for about 45% of all water related disaster in the world in terms of the death. This is a significant number. Next, please. So while talking about the natural hazards in terms of, and which is translating into disasters, especially in the Southeast Asian countries. So we have seen the trend, like how it's actually going, what type of impact we can see from different countries. So last couple of decades, data are plotted here from the World Meteorological Office. And mostly we have plotted on the water related disasters here. So you can see like there are countries like Bangladesh, Myanmar, and India and China, which are mostly impacted by the water related disasters. Let's see some of the examples in a couple of slides. Next, please. So the area what actually we would like to discuss about the essential services. When we stuck with some of the water related hazards, it might be cyclone, it might be flood, or it might be some storm surges. So in any of the cases, drought also, in any of the cases we have first impact is on the essential services, which is actually impacting in various aspects. And also it has a long lasting problem with the cascading impact that possibly we need to discuss now a little bit more. Like we need to have some sort of systemic approach to understand how the dynamic process or the complex process is working, and how the sanitation sector is actually linked to that. So water management, waste management is one of the issue. Healthcare is also coming up. These three highlighted part we thought like is one of the three major area where we need to have more focus. Agriculture and livelihoods are combinedly also addressed with the water related hazards. Trade and industry, this is also linked to the livelihood options. So we have seen like it's also cascading impact we have seen in various sectors. Like in case of drought, we have seen the industry close down due to drought for the service industries. And also for the flood impact, one country is impacted in Thailand. We have seen Thailand is producer of about 40% plus of hard disk in the world. So in 2011, there was a major flood event, is covered about 90% of the country. During that time, like about 45 to 50 days, the export was closed. So many of the countries which is depends on the essentials from Thailand was also impacted extensively. So the trade and industry also impacting a lot due to the cascading impact. Next, please. So here lies the correlation how our climate impacts to the different segment of the disasters. So while talking about the building resilient, climate resilient sanitation system, we also need to understand or characterize the risk for the various type of hazards. So on the right side, we can see like the various types of hazard and is classification actually. So in terms of the origin or the based on its origin, it is natural and man-made, and also based on is sort of timing or temporal segment. We can also divide into rapid onset, slow onset, and the right side also you can see various examples of the different hazards. But all the hazards will not translate into disaster. That is most important component. All the hazards mentioned here will not translate into disaster unless and until, if you see the left side, which is IPCC Year 5 report, is actually promoting this diagram and this concept of risk, where we have to consider the exposure of that particular entity and its underlying vulnerability, and also weather factors. These three factors actually coming up with a particular aspect. When it crossing certain threshold limit or beyond the coping capacity of that particular community or country, then we can call it as a disaster. So disaster is perspective or a contextual. Say for example, like road accident, for 2 people may not be a disaster, but road accident, 2 people, 20 people died may be called as a disaster. So it's completely perspective based. Next, please. Okay. So linking with the previous slide, we have tried to categorize like different impact of the water related disasters into slow and rapid onset of events, what you can also call as a hazards. So some of the rapid onset of hazards like flood, creating like waterborne disease, and also vector-borne disease like malaria, dengue, and other things. Third one, like physical and mental health problems can come with mostly with the rapid onset because of the high number of death. Fourth one, the malnutrition, mostly coming up with the slow onset of events like drought is a slow onset of events. Livelihood loss, sanitation and hygiene culture. This is the last point, is most important part of the, at least we have seen in the Southeast Asian countries. We need to embed the risk culture or the sanitation and hygiene culture. That is the most important, how to change the behavioral pattern. Okay, thanks. Next one, please. Now we'll come up with some of the examples. This is the area right now we are working with one of the project for the GCRF, UKRI GCRF project in the GBM Delta, Ganga, Brahmaputra and Meghna Delta. So right now I have pointed out the eastern part of the western part of the Delta. This is in Indian part of Sundarban. This is also World Heritage area, as well as highly densely populated. And you can see the right side statistics, like 2.2 million people live below the poverty line. That is about 50% of the regional total population on that particular location. And the frequency of cyclone and storm surge is also very high. The last big cyclone happened recently last year, 2020. And before that, there was a huge cyclone impact in 2008 and 2009 as well. So we have tried to see some of the impact happened last year, where we combined, like we have tried to see the multi-hazard impact in the sanitation sector, where we have the pre-existing vulnerability in terms of COVID, at the same time cyclone Staack. So how the impact actually exacerbated due to that dual impact and dual disaster. Next, please. This is the diagram we have conceptualized, and recently we have published in one of the international journal, taking the context from this 2 disaster we call the dual disaster. So where a cyclone is one, which came as a sudden shock, and COVID is also initially it was sudden shock, but it was also going very, very steadily for a couple of months. So we cannot say like sudden shock. So there are 2 things combined together, and you can see on the top we have followed almost like the year 5 context of IPCC, like vulnerability, hazard and exposure, and tried to see like what are the elements actually contributing to the vulnerability of that particular population. Next, please. Next example, we have tried to see like one of the extreme event happened, Cyclone Nargis in 2008. I think all of us are aware about this in Myanmar coast. That is also Delta community. That Delta community is also impacted extensively due to various aspects of like for the cyclone, mainly due to the storm surge. And after that, actually, we have seen some of the projects launched by the government. Then the community and local response was also improved. So in 2018, we have seen a total of 110,000 people gained access to the basic water supply. There is a picture on the left. You can see that water they used to take from a very sort of area which is the water is not very clean. So that water possibly will be used for drinking purposes and also cooking purposes. So now it's improved a lot in 2018 for a large number of families. Next, please. Few challenges we have to also look into. There are a couple of research gap on the physical and social relationship of the hydrological processes. Risk communication is one of the critical gap we have found out from various research in this domain, especially on the disaster risk governance. Technological limitations on the risk. This is also area like where if you see the the internet penetration is about 50% in this region, entire region. So the 50% penetration, the technological limitations possibly quite low to propagate a couple of information very fast. Lack of safety net for the people, that is also depends on the social safety investment from the government side. We have seen very low in 2015 report also came up from the UN Global Assessment Report, says about the safety, social safety investment is very, very low in some of the countries in Southeast Asia. The next part is a translation of knowledge into policy development. This is one of the area right now we are working. We need like a lot of work, how we can translate the scientific community's perspective to the policy development. Many other times we have it's a large gap area we have to focus. Lack of cascading disaster foresight in the health context. So we need to also foresee, like if flood happened, then what are the cascading impact might come in as a sort of post-flood impact in the sanitation sector. So we really need to see that as a cascading disaster, as a foresight. And interagency planning and implementation is also required for the coordination. Next, please. This is the last slide, or a few recommendations. Maybe water-related disasters and its impact to the sanitation infrastructure should be prioritized. Right now, maybe we see more of a service delivery, like whether it's accessibility and affordability, but maybe that particular infrastructure and service sector, as a service sector, we might not be that much looking into that perspective. So at the national level, we need that policy to be implemented. Improve the interagency cooperation. We have seen in all the Asian countries, almost like Southeast Asian countries, like interagency cooperation at various level is very poor actually. Like the coordination between the water department, irrigations, and maybe the sewerage departments are not there at all. So many of the times we have seen like sewerage line and the drinking water lines are going together in just next to next. So it is not at all acceptable. Conserve and protect watershed and natural ecosystem. This is also a major challenge. Unplanned urbanization is going on very, very rapidly and compromising with the watershed areas. Climate sensitive risk governance mechanism need to be implemented in line of the Sendai framework for disaster risk reduction, which is also aligned with our SDG goals. There are 4 priority areas, which is some extent, some of the priority areas for Sendai framework is also aligned with the SDG. So we also need to see the governance component. Assessment of the cascading impact on the sanitation and hygiene infrastructure is a key what I need to focus more. Addressing systemic risk to the water related hazards for resilient sanitation system, and develop a state implemented policy on insurance coverage for the countries and prone to the water related disasters. And finally, improve the understanding of the underlying risk factors, which is also linked with the livelihood and the poverty and education. So with that, I'd like to conclude my discussion on the regional perspective with some of the local examples. Thank you.
Thank you, Indrajit. That was very interesting. Let's just
I
all
got
take
few questions. Maybe I'll respond in writing.
Yes, please respond in the chat. So unfortunately, we don't have time to answer questions after every presentation, even though I'm sure people are stimulated in their thinking. And yeah, please put your questions in the chat and one of us will attempt to answer them.
Sure.
Yeah, let's all take a breath before we move on to Professor Deepthi's presentation. She will be looking particularly at whether emergency sanitation management is gender sensitive. So Dr. Deepthi, I'm handing over to you.
Thank you, Petra. Good afternoon, everybody. And I'm Deepthi Wickramsinghe from Sri Lanka. And I'm going to share some of our experiences, which could be common to the region. And I have a question. Is emergency sanitation management gender sensitive? Next one, please. I would like to start my presentation with this picture, which tells a story with thousands of words. You may now spot what this flood victim is carrying in her hand. Next one. At the onset, the climate change represents the most significant and destructive challenges of the 21st century, which have been causing frequent and intense disasters, including extreme weather events, storms, heat waves, and wildfires. So these disasters have very detrimental socioeconomic and political as well as environmental impacts. Next one. So disaster management then becomes an essential element, an urgent component of any climate change adaptation agendas and programs, which is connected to sustainable development goals, particularly the sustainable water and sanitation management, which is denoted by SDG 6, which focuses on giving access to water and sanitation to all, not leaving disaster victims behind. Thank you. Next one. Next one, please. Managing sanitation is a crucial thing, very essential element during emergencies and natural disasters, because during these stressful, uncertain circumstances, basic health condition can be severely affected. Next one. So going back to my country, Sri Lanka, where I'm from, we are an island in the Indian Ocean. So we are situated closer to the tip of India. And we are, being in the tropics, we are a very hot country. The temperature is around 27 to 28 degrees Celsius throughout the year. One of the hottest countries in the world. Next one. So as Sri Lankans, we are vulnerable because we have high temperature, unique and complex hydrological regimes, and exposure to extreme climate events. We have experiencing and seeing the rises in minimum temperature, which is also projected to be faster than rises in average temperatures. And we face significant threats from extreme heat because the number of days surpassing 35 degrees Celsius is continuously growing. At the moment, it is 50 out of 365 days, and it will go up to 100 days. And we see increased incidences of hazards and like Indrajit pointed out, a cascading effect of these hazards. Next one. So under this backdrop, so what is the role of sanitation in emergencies? As we all agree, the best emergency sanitation system does not exist on Earth. In any system, any emergency management, there could be a lot of issues, uncertainties, problems, panicking, stress, and the managers who manages these emergency programs are facing lots of problems of evacuation of victims, providing the needs of the victim, the shelter, food, drinking water, facilities such as toilets and water. Next one. Now, we find these victims under hazards in two conditions, in situ or ex situ. In situ conditions is quite simple because victims are at their own home, so with relatives and friends who are known to them, right? The system, the surroundings are familiar, not much movement involved. The family setup is there, and but there could be issues related to medical needs, the supply of essential goods that could be a little problematic, medication, poor services, and communication issues. They are under stress. But next one, when it comes to ex situ conditions, where the victims are being moved or evacuated to live in a short time for under a temporary shelter, there could be many issues, like the victims are not familiar with this setup. These structures could be poorly articulated. Most of these places are very crowded, and poor management and organizational setup is inevitable, and lack of poor supply, and lack of adequate space, food, and other needs. So, especially the victims under ex situ conditions are under a severe stress. Next one. Now, my question again, is emergency sanitation management gender sensitive? I would say rather no, because the safe menstrual hygiene management is crucial and a but very under-addressed issue during emergencies. And this is because this menstrual hygiene management is somewhat neglected in basic health agendas for emergency and crisis situations. Next one. We can identify 3 interrelated or interconnected areas under emergencies. Stigma and silence around menstrual hygiene issues are there because the menstrual hygiene has been a taboo word, and negligence of securing menstrual hygiene. Similarly, everybody faces difficulties in supplying essential items to women like sanitary pads, clothing, specific medication, utensils. So they are under stress. Next one. We have identified different aspects of people who are under the women who are under emergency in relation to sanitation management. Biologically, they need certain stuff, certain things for their hygiene and health, and they need to get sanitary pads, clean undergarments, and clothing for change. Next one. Physically, they need to have a place to change and wash clothes. They need adequate water and soap. And it's very difficult sometimes to find a proper place to dispose of used sanitary pads. And especially the places to lie down and rest among these crowd and temporary shelters, because most of the time, especially the young girls, they get other physical ailment in relation to menstrual hygiene. Next one. And then the social aspects. So we have many times seen unequal power relations because in most cases, men could be more dominating in decision making, neglecting the needs of women, being insensitive the needs of women. At the same time, females are handicapped by the fear and shame of being in public places unprotectively, because during menstruation they need to be protected, and they are using poorly sheltered and covered toilets and washing places, and there could be safety and privacy in changing and washing places. Next one. So finally, the tip of the iceberg, the psychological aspects. We have seen only the tip here. Most of these related aspects are hidden. The discomfort and shame to talk about the menstrual hygiene, and especially the young girls, they are reluctant to request help from others. There could be immense psychological stress as their needs are not met, and fear and shame. Next one. So we have seen, I think this is common to many regions, gender norms and values and behaviors can have significant influences on the health and sanitation of women in these temporary shelters. Two common examples, we have seen that attention given to maybe a pregnant woman or an elderly person is not paid to the same to a young girl who looks healthy and dynamic, but she might be suffering silently because of the menstrual hygiene issues. And similarly, in some societies, young girls and females are not allowed to mix up with the crowds and speak, right? So their grievances and are not heard. Okay, next one. So my recommendation and what I need to suggest is a way forward in relation to gender sensitive emergency management. So gender sensitive planning should be focused on 3 phases of the disaster: pre, during disaster, and post disaster. There should be women in emergency planning committees for disaster management, and we need to accept the female oriented needs and items should be included beforehand for the list. And if the governments and agencies can't provide these, they need to find donors to get some items like sanitary pads and other clothing. Awareness raising and more research and communication too are equally essential. Next one. So Under the wrapping up, this is my appeal. Let's understand the hidden pain behind a smile. And we should act today. Thank you very much.
Thanks very much, Deepthi. It's very interesting. And I believe Dr. Devanmini will lead us on from there and take us now into the next presentation about sanitation and drought situations. So
Thank you.
Dr. Devanmini, over to you.
Yeah. Thank you, Petra. Yeah, so in here, what I'm going to focus basically on droughts and how droughts affect the sanitation and hygiene issues. Next, please. Yeah, so has sanitation gained enough attention in drought situation? So for that questions, basically the answer is no. Next one, please. So when we considering these droughts, there are so this newspaper article is about over 645,000 people affected by droughts. Next. So basically, most of the time, the governments, another one, a government and the authorities, they are focusing on the cultivation. So the next one is about cultivation areas danger because of the droughts, and then there is farmers affected and they are threatened in hydropower. So most of the time, the governments and the authorities, they are addressing on these type of issues: farmers, threats in hydropower, food, water, those kind of things. And the sanitation and the hygiene is always kind of neglected. Next, please. So why? The question, we'll see the next one, please. So when we are answering the question, why sanitation does not gain enough attention through drought situations, the first one is we have to understand that droughts, they are kind of different from other climatic hazards. So when we considering the floods, landslides, or tsunamis, we know there is kind of a natural disaster. But when it comes to the droughts, we don't know whether we are in a drought. So when we realize that we are in a drought, that means that we are in the mid of a drought. So the second one is the droughts, they are very slow, and as well as they are lengthy. If it is a flood, then it's very like a couple of weeks. But when it comes to a drought, then it might be 1 year, 2 years, maybe sometimes decade. Therefore, the authorities always prioritizing in drinking water, agriculture, and hydroelectricity rather than thinking about the sanitation and hygiene. And also, the sanitation is the last thing that people would think and they consider in a drought situation. Next, please. So we know that the key issue with the drought is drinking water, and even in as well as in Sri Lanka and most of the countries, this issue, the drinking water issue, is always addressed. So in this presentation, I'm basically focusing on how people manage their personal care with lack of water. So in these two pictures, you can see even in Sri Lanka, if there is in a drought season, the governments, in the first picture, you can see the government provide drinking water from the bowsers. So the communities come to that bowser and then they collect water from their utensils. And also there are small scale drinking water projects for the schools or the religious places, community centers where the people will get good quality drinking water. Next, please. So in Sri Lanka, basically the main water source is wells, and we have the pipe-borne water in the urbanized areas. In the dry areas, in the dry locations, we have the rainwater harvest tanks and irrigation tanks as well. But basically the wells are the main source of water in most of the areas in the country. Next. So when considering the droughts and these hygiene issues, we have to think both the quantity and the quality of the water. So with the droughts, the quantity as well as the quality, it's affected. So the quantity is reduced, and because of the stagnation and the pollution effects due to the stagnant water, there is quality of the water also affected. So both are necessary to maintain good hygienic practices. Next, please. So in these two pictures, you can see that people are coming, especially the women, they are coming with the pots and collecting water. So the main concern in sanitation with the droughts, it's the fecal contamination in the water. So people use their utensils to carry water, which are not safe. They walk far away to get water. So both pictures, they are in coastal area. So these women, they bring the pots and they dig the sand and they find small water holes and then they collect water. So sometimes it costs to transfer the pathogens on one place to another. And for the domestic purposes, the water is used carrying nearby water sources. So the microbial pathogens cause waterborne diseases, press because of this fecal contamination in the water. Next, please. So in this chart, you can see the different types of water-related diseases caused by fecal or urine pollution in Sri Lanka, in a particular part of Sri Lanka. So you can see it's like 36% is basically diarrhea, and 30% is typhoid, and there are 30% is other infectious diseases, and there's 12% is typhoid. So there are the diseases that basically because of fecal and urine pollution in Sri Lanka. Next, please. One main thing when we are considering these hygiene issues and the droughts is the lack of awareness and the negligence. So that we know that drought triggers the people to consume water without thinking about the hygiene. What they really want is some water to drink and for the day-to-day cooking and washing activities. So the remote area, people do not consider about the waterborne diseases, which leads chronic conditions and sometimes cause death. But unfortunately, sometimes people don't know the deaths are because of these chronic conditions. Next, please. When considering the part that neglected part, so the related to women, girls, and the babies. So the access to safe water is critical for the health of women as well as the babies. So the women, basically, they have to travel far away to get water. So in these two pictures, you can see in the first picture, like those women, they are not new bottled water. So they fill the water for the old bottles. So they reuse in these bottles and they fill them and carry them far away through a wheelbarrow for their homes. And then also you can see that in the both pictures, there are kids, and the second picture that siblings are carrying their younger siblings to fetch the water. So the babies, especially the infants, they are carried by the mothers while they are going to fetch water. And then the prenatal and the postpartum health. So we know for the pregnant women as well as after giving the birth, the water and the personal hygiene is very important. And these groups are also neglected. So the women and children bear the primary responsibility for the water collection. I think it's not only a problem in Sri Lanka, in most of the part of the world, the high percentage of water is carried by the shoulders of the women and the children. So it's kind of their responsibility. It's women and children's responsibility to get the water for their families. Next, please. And then when considering the girls, especially the menstruation health and the hygiene. So when the women get water, drinking and the cooking get priority. Even though they walk far away to get the water, the priority is going for drinking and the cooking. So how women manage without water for washing clothes and while they're having their menstruation cycle period. So it's not, nobody talks about that. So even though they walk far away to get the water, so those water will be gone for the cooking as well as drinking and the other household work. So those things we have to address, and we have to aware the people, aware the young generation, and aware the people on those things. Next, please. For the recommendation, basically the supplying and the instruct people to consume pipe-borne water. So the supplying the pipe-borne water is kind of the responsibility of the government and the authorities or the local authorities. But instruct people to consume the pipe-borne water, we can aware, because there are sometimes myths with the people are thinking that the pipe-borne water is chlorinated, so it's not good to consume. So they tend to use the well water from the wells. which is not sometimes in good quality. And then the check the water sources to identify the water contamination in the drought season, at least especially in the drought season. If the authorities can check the contamination in the water sources, then it would be good. So the people know that what are the contaminants and what are the consequences that can be happen. And then the awareness among the people about the water contamination. Especially the water and the sanitation is a human right. Most of the time people don't know it's a human right, like water and the sanitation, it's a human right. So we have to aware people that sanitation is a human right. So you have to write, can fight on your sanitation if the authorities are not providing it. And then water contamination and the seriousness of the waterborne diseases. That is also, we have to aware the people like these kind of contaminations can be in the water, and also it's very serious. These kind of serious diseases can be happen because of these water contamination. So those are the recommendations that we can follow up the hygiene related with the droughts. So that's all, I think. Next, thank you very much. I think we have yes, Petra.
Thank you very much for that presentation, Devanmini. So I hope you found all that very inspiring and informative for you. To have a bit more interaction, we're going to go into breakout groups now. So give me a moment while I send you off into those breakout groups. But just to let you know, we have a specific question that we'd like to ask in those breakout groups. I'm going to post it in the chat, and I'm also going to tell you now. So we'll have 20 minutes in the breakout groups, and in each of the breakout groups, there will be a facilitator who will make themselves known. And that facilitator will then also find someone who will take notes and who will be the presenter back to plenary. The question we'd like to discuss with you is, how do we integrate climate thinking within sanitation and hygiene programming? So I'm going to put that in the chat. You'll see it there, 20 minutes. You'll be sent off automatically into those rooms, and there'll be a message to tell you when to come back. I'm just going to take a moment to assign you. So if maybe Ruhil or Jeremy or Finn, you would like to say something in the meantime, that would be great.
Just thanks, Petra, for managing all of this. And also thank you to all of our presenters. Very interesting presentations, and also seems like really the impacts of climate hazards. I mean, it seems like there needs to be we need more structural efforts across what Indrajit was saying in terms of policy, infrastructural, and sort of cross-sectoral thinking, but then also a lot of what Deepthi and Devanmini mentioned about local level programming that needs to consider a lot of very varied realities, is what occurred to me. Jeremy, do you have anything to add?
Thanks, Ruhil. That's good.
Okay, so I'm ready to send you into breakout groups. See you very shortly, and I hope you have a good discussion. Ruhil, you might have to make me host so that you can go into room 4, or unless you can choose to go to room 4.
I can join room 4.
Hi there, can you hear me? Hello there. Hi, David. I don't know if you can hear me. The session is almost over, but if you like, I can allocate you to one of the breakout rooms. There's about 8 to 9 minutes left to discuss. Just send me a message in the chat or let me know by voice if you want to join. Gabriela? Can you hear me?
Oh, hello. Yes.
Yes,
thank you very
the
much.
session is almost over, so we've got another 15 minutes, and people are currently in breakout groups in discussions on the question of how we integrate climate thinking within sanitation and hygiene. If you like, I can assign you to one of the groups if you want to
Yes,
catch
please.
the remainder. Yeah?
Yes, thank you very
Okay.
much.
Hang on, I'll
Very
share
glad.
the room. Good, you're going there. Hi, Danilo, can you hear me? People are currently in breakout rooms for another 3 minutes. So I don't know if you want to join one or not. We're then going to come together in plenary to discuss. The question was, how do we integrate climate thinking into sanitation and hygiene programming? If you want to give me a sign that you're there, then I can either put you in a group for the last couple of minutes, or you can just hang around till people come back from the breakout groups. Hello there, Maximilian and Danilo. The group is currently in breakout rooms. They're going to come back in 2 minutes. Then we're going to have some feedback from the discussions they had there on the question of how to integrate climate thinking into sanitation hygiene programming. So if you want to hang around for that feedback, then you're very welcome. Welcome back, everyone. You can just make sure if you're just coming back that if you're not a presenter, that you mute yourself again. That can sometimes happen when we move from the breakout groups back into the main space, that we're unmuted, just so that we don't have any background noise. So, is everyone back? Yeah, everyone's back. Welcome back. I hope you had a really fruitful discussion in those groups and have gained some more insight into the topic. So as we said before, and as I'm sure you arranged in your groups, we're going to have just some feedback, some reporting back from each of the groups if you can keep it to the main points and put anything else that you don't have time to say in the chat, that would be great, because we've got another 12 minutes left of our session. So can I ask Indrajit, who was the note taker presenter in your group?
Yeah. Just I'm in chat with James. So James kindly accepted. So James, are you ready? Like, he has taken few notes, and then if he's missing something, then I'll also supplement.
Yeah.
James, what do you?
Sure thing. So our main focus was sort of started by discussing sort of the IPCC report and saying climate change is looking really bad. There are lots of natural disasters that will be occurring in sort of low income part of the world. And so the first thing that was raised was sort of the concern about lack of climate change assessments, that currently there haven't been many assessments done, that it's not really part of our drivers for developing sort of sanitation interventions. And one sort of key one that was brought up was, for instance, open defecation campaigns that have done really good work of reducing open defecation, but there's like a ticking time bomb of that. If a climate change, hazard occurs, could potentially damage these septic tanks, or, collection methods that would put you back at square one if they got damaged. And so a lot of the focus was on how do we improve resiliency? How do we actually design preliminary assessments to, as I said, improve that resiliency? And one of the key things brought up was we should also firstly understand our existing problems, how they will be amplified by climate change, and what the new problems will be. And that should hopefully be able to create a big picture of what needs to be changed and how we actually combat this resiliency. And that's when we sort of moved on to improving understanding, or sort of trying to understand hazards better was sort of raised. One of the key ones was sort of describing that it won't only be water-based hazards, it could be wildfires, it could be sort of knock-on effects due to climate change, and sort of understanding again what is going to be the main causes of damage, and just sort of then led on to it won't only be sanitation services being disrupted, but it could also be damaging to infrastructure such as roads, and that we'll also see sort of differences between urban and rural hazards. So we can't just clump it all together in one block and work off the same textbook. A lot of emphasis on improving understanding. And so the final point I got was sort of a services approach of saying one of the ways around so trying to understand the priority of the impact during these hazards is people may forget about sanitation. We may be focusing more on making sure that people's livelihoods are maintained, but there may not be sort of mitigations for damages to sanitation, or that we could be taking a step backwards if sanitation services are disrupted or damaged. So there were a lot of great examples of making sure that we create an integrated approach, that sanitation is at the forefront in disaster management and is integrated into the overall sort of mitigation plans. And sort of just the final points were sort of making sure that sanitation is linked to the health and economic benefits. And then that sort of led on to our sort of final question before we ran out of time of how that this could also potentially mean that wash could be used for something for good. We all know that sort of the emissions based on sort of fecal sludge management and sort of how they could be used potentially for biofuels or reduce carbon emissions. So definitely sort of prioritizing and integrating it now could also see sort of a technological advantage. That's all I got. Did you get anything else, Pal?
Yeah, thanks, James. Yeah, almost.
Thank you, James. Indrajit, if you have anything extra, maybe just put it in the chat so that we can hear from
Yes,
the
sure.
groups. That good. And James, if you have the notes typed up already, you're also welcome to post them in the chat so that people can see them, but no worries if not.
Sure thing.
So Devanmini and Deepthi, who was the reporter in your
Yeah,
Devanmini will be reporting.
So, yeah. So basically, we were talking about, so at the beginning we were talking about, yes, climate change is real, and we have to think about the mitigations and the impact. So and as communities, we have to focus on the adaptations, and we have to think about what we can do, what are the things that we can do in the planning stages. And also we have to be kind of more strategic when we are doing the planning, and be kind of more flexible and have flexible mechanisms. So for an example, one example was like providing robust toilets in the flood disasters, because those things like for the flood proof toilets are very expensive. So we can't give those kind of toilets for each and every house, but what we can do is we can create a couple of toilets in the schools. So where when there is kind of a flood emergency happens, and the communities can use that toilets. So so because we know that emergency situations are very difficult to cope difficult, so we have to be clever enough to have those kind of mechanism to solve the problem. So because the governments in Sri Lankan context, that like the governments or the authorities, they know like these kind of disasters can happen. Like for example, in the monsoon seasons, the floods happen. So if the government can have some the what you call that the toilets that you can move, so then they can, if they are readily available, then they can transport them to the places where necessary.
Mobile toilets.
Yeah, sorry, the mobile toilets. Yeah. So then the next point what we discuss is that when in the drought seasons, but most of the time we know that we have this the flood relief camps, but when it comes to the droughts, it's rarely considered this kind of thing because of its slow, and we so what the governments can implement the things such as if for the toilets, for the hygiene, the toilets, then we don't need the very quality water. So if we can have some water basically for the use in the toilets, then that those kind of mechanisms can be developed. And also from Burundi, or Burundi, that they are having certain kind of difficulties in especially the managing with the COVID pandemic, the water, the sanitation, water management, and the sanitation during the pandemic. And they are doing some sustainable climate projects and the water management projects. And also it's as per in there, it's very kind of those projects, sometimes they are very expensive. And the one comment comes was that when in the water management, especially if there are water purification project, that we can use the natural ecosystems for the water purification, such as the constructed wetlands. So those kind of things has been seen in China. In some villages, they have used this construction wetlands for water purification. So because this when it comes to the water purification projects, those are kind of very expensive and technical. There has to be a lot of technical aspects. And if we can go with this ecosystem-based solutions, then we can move on with low-cost solutions. And also in Indonesia, that there are some another comment that came by was, when we are addressing the disasters, we know that we have to aware the people, because these disasters, they affect in different regions in different ways. So when we are addressing based on the geographical location and also the societies, they face even though it's the same type of climatic disaster, they face it they experience it in different way. So when we are doing the awareness and when we are doing the planning, so we have to be unique based on the geographical location, as well as the climate, as well as the society or the ethnicity and the things. And yeah, so those are the things that, and also we have to, as the final comments, that we have to when we are doing the plannings, that we have to when doing this adaptation, and when we are developing these agendas, we need to specifically have our concerns in gender-related issues, that the penalized groups, the women, and the gender-sensitive issues that we have to address in the decision-making process. So those are the basically things that we discuss.
Thanks very much. If you have those comments, you can put them in the chat as well if you have them written down. If not, no worries. So we've got 2 more groups to report back, and I'm aware of time. So Ruhil, who was the reporter in your group?
That was me. I'm trying to make it short, to keep it short. So the first thing that we discovered was that in many projects, there's still a lack of understanding of climate and sanitation challenges. Starting from the programming to the planning, but also to the work with local communities. So there, really, the projects must include understanding of climate challenges as well. Another thing was that choosing the appropriate technology, maybe also including a change of mindset, because in many regions, the flush toilet is still the standard toilet of civilization, one could say. However, it highly depends on the water availability, and also with each flush, one pollutes big quantities of water, which is also like another ecological problem. And the third thing was that the resources are limited. So resources for immediate relief, for example, for droughts or for floods, that's already challenging enough. But then when there's another challenge, for example, with COVID, it might very quickly pose 2 big challenges on communities. So that should also be kept in mind, that the resources are limited. That's it from my group.
Thanks, Finn. If there's anything else from that group, please feel free to put it in the chat. And then Jeremy, who was the reporter in your group?
Thanks, Petra. That's me. So I'll just try to be really quick because I see that we're out of time right now. So apologies to my group. We talked a bit about informed choice around technologies and the need to get it right first time. So we need to influence policy to support the decision of climate resilient technologies. For example, in India with the Swachh Bharat mission, that hasn't been done. A lot of technologies that are being built right now are probably not going to last through climate extremes, and that's going to push us back to square one, as James mentioned. So we need to do things like improve the regulation around septic tanks to ensure that they're being built in right ways. Are there ways that we can catalog latrines that are already built and target ones that need improvements and do monitoring to ensure climate resilience is being built throughout areas? Choosing right technologies. Obviously, sewers won't happen in rural areas, but we do something better than just building latrines out of low-cost materials. So better guidance around informed decision-making around technologies, and also guidance, tools and guidance on what to do in terms of areas that are frequently flooded or water scarce, and providing guidance to service operators at treatment plants and other services about what to do during emergencies or disaster contexts. And then finally, a comment about how in rural sanitation, we usually do an examination of the context before we implement a program, but climate change is always changing that context. So how do we take that into account? How can we support communities and practitioners to be a bit more futures, thinking about how context will look in the future? Thanks.
Thanks, Jeremy, and thanks everyone for the rich discussions by the sounds of it. So unfortunately, we've run out of time. It seems there's a lot of stuff we could talk about around this topic, and there will be more. And thank you for all your participation. Thank you to the presenters. We're also currently hosting a discussion on the Susanna Forum around climate change and rural sanitation. So if you want to have a look and contribute your experiences and your ideas, your questions, your suggestions, then I've just posted the link to it in the chat. Please take a look. There will also be the slideshow from today, and the recording will also be available afterwards. Finn has already posted the link to the Susanna website where that will be uploaded. And we'll also put some stuff on the Sanitation Learning Hub website, so you'll find it in all the normal places. As we mentioned at the beginning, a lot of what Ruhil and Jeremy presented earlier was based on the frontiers that we published earlier this year. So I'm also going to put the link in the chat so you can download it if you haven't seen it yet. And yeah, please find out more from the various websites. Jeremy and I posted some links earlier in the chat that you can find, and otherwise you'll find some links on the Susanna website. I'm going to just say, Ruhil, Jeremy, Deepthi, Devanmini, and Indrajit, if you have any very short last words, then you're welcome to say whatever you need to say.
Thank you, Petra. Actually, thank you very much for this opportunity. This is from both Devanmini and myself. So we talked about a very important aspect, a hidden aspect, neglected aspects of climate change adaptation. So, and we need to take this forward, these ideas and suggestions forward from here. So please help us. We'll get together and we'll work for towards a common objective. Thank you very much.
Thank you.
And nothing else, just thank you and enjoy the rest of your Susanna sessions and your Susanna week.
Yeah.
Thank you very much, everybody. Stay safe.
Thanks,
Thank you.
everyone.
Bye-bye.
Thank you.
Thank you.
Thanks,
Thanks a
everyone.
lot. Stay safe.
Bye.
Bye.
Thank you.
Thank you.
Okay. I'm going to end the.
Excuse me, Petra. I have a question.
Thank you.
Is there going to be any preparation of a report based on this session? I would be very glad to contribute if there is something going on with results or to provide some inputs.
Petra, you're muted.
Ruhil, I don't know if you know, but I'm not sure if there's anything planned other than the recording of the session.
No, but there will be other ways to just get involved in a lot of climate and sanitation work that we're undertaking. So we can maybe flag that in
Yeah,
this.
I mean, Gabriella, yeah, if you have any specific suggestions or things, then maybe you could send an email to Ruhil. Do you want to put your email address in the chat? You could contact Ruhil directly. And also, if you check out the links that are posted in the chat, then it would be great to have your ideas on the discussion forum.
On the discussion forum and on the links, you mean?
Yes, on the link. There's a link to the Susanna discussion forum that I posted just now. So that's one place to put your ideas and your questions and your suggestions. And then you can also contact Ruhil directly via the email that you just put in the chat. Because we're going to be undertaking more of this work on climate change and sanitation as we move forward. That's kind of our thread at the moment.
Okay, perfect. I'm very interested on this topic because I think one have to consider a lot the topic of planning, integrated planning on climate change resilience and sanitation, but also I'm very interested in organic waste treatment, so waste management. And wastewater as well, so both of them, and the context of resilience and climate change. So I find it very relevant, and perhaps there is opportunity